Hello everyone, welcome to my YouTube channel. This is Dr. Naz and today I will be discussing about rubella, which is also known as German measles or 3-day measles because its rash lasts for 3 days. So without any further ado, let's get started. So rubella is caused by RNA virus, which is included in Toga virus family, and its mode of transmission is via respiratory droplets. The disease progression is similar to measles, that is starting from incubation period. Then it starts the prodromal illness, then enanthem, then exanthem. Enanthem, which is the rash on mucous membrane, and exanthem, which is the rash on skin. The infectivity period, that is when a person is highly infective and it can cause infection to other people, is 10 days before to 2 weeks after the onset of rash. So when the rash starts, 10 days before the rash and 2 weeks after the rash, the patient is highly infective. After the incubation period, which lasts for 15 to 20 days, prodromal illness starts, and it includes fever, malaise, lymphadenopathy, which is enlarged lymph nodes of suboccipital group, posterior auricular, posterior cervical group of lymph nodes, and it is a characteristic feature of rubella infection. Adult, especially women, can also have arthritis, that is inflammation of joints, especially involving hands and feet. These are caused by immune complexes. The enanthem which occurs in rubella infection is known as Forsheimmer spots. These are small petechial lesions on the soft palate as shown in the picture. They are suggestive but not diagnostic of rubella. They can be caused by decreased platelet counts, which is a complication of rubella. Exanthem of rubella is maculopapular rash, which is similar to measles. Macule is change in color, it's red, and papule is a raised lesion. It also begins on face and it spreads to the rest of the body, and it lasts for 3 days. That's why it is called 3-day measles. So if a child comes to you with fever, malaise, and if you examine the baby and you see there are enlarged lymph nodes in the cervical region or posterior auricular region, and he has fever and you see rash all over the body, see, in measles there is no lymphadenopathy. I mean, there is lymphadenopathy, but it's not as common as in rubella. So, and you examine the palate, there are petechial lesions, so you will go towards the infection rubella. And also I would like to tell that in measles there can be generalized lymphadenopathy, whereas in rubella the posterior cervical, posterior auricular, and suboccipital lymph node group are involved. Now this is a picture of a typical rash of rubella. You can appreciate that these are raised lesions which are red in color and they are all over the trunk. Sometimes it gets quite difficult to distinguish between a rubella rash and a measles rash, but obviously it needs practice. Complications of measles include thrombocytopenia, which is decreased platelet counts, hepatitis, encephalitis, and congenital infections, that is congenital rubella syndrome, and its risk is highest if the infection occurs in first trimester. So if a pregnant lady gets exposure of rubella in the first trimester, there are high chances of developing congenital rubella syndrome, and the characteristics includes congenital deafness, congenital cataract, congenital heart disease, especially patent ductus arteriosus, and mental retardation. These defects depend on the gestational age at which the infection occurred. For example, in first and second months, if a pregnant lady gets exposed to rubella, the neonate will get cataract and glaucoma. In the first trimester, the most common defect will be congenital heart defect or patent ductus arteriosus. On the 4th month of pregnancy, the cognitive defects and deafness is most common, and in the 5th month, retinopathy, cataracts, which is salt and pepper cataract, is very common. Even if the infant is normal at birth, he has increased incidence of other diseases like diabetes later on in life. So the diagnosis of rubella infection is made by measuring the antibodies present in the blood. So rubella specific IgM by ELISA refers to acute infection if it is present, and IgG seroconversion detects 14 days after acute infection. In exposed pregnant women, absence of rubella specific IgG confirms the potential for a congenital infection. How can we prevent rubella infection? The measles, mumps and rubella vaccine. This vaccine is given at the age of 12 to 15 months, and a booster can be given at the age of 4 years. All women of childbearing age should be tested for rubella and vaccinated if seronegative. Treatment is supportive. It's written that childbearing age women should be given vaccine. It doesn't mean that you have to give vaccine to the pregnant lady, because it's a live attenuated vaccine and it cannot be given in pregnancy. It's contraindicated. Further, if a person get infected, that is the natural infection, it leads to lifelong immunity because your own body's immune system make antibodies against the virus. So it will act as vaccine. The treatment is supportive. You have to treat the fever, the malaise. That's it. That's it for today. Thank you for watching. Make sure to like this video and subscribe to my YouTube channel so that I get motivation to make further such videos. I'll try to make them as concise as possible and clear. Also, I would like to say, if you have any query, you can ask in the comment section. If you want me to improve anything in this video, you can also tell this in the comment section. Thank you for watching.